Many people are unhappy about the size and shape of the nose. Often they have been teased about their noses since they were children or have felt embarrassed about them for many, many years. They want a nose that is better balanced with the rest of the face, on that complement their other features rather than dominating their appearance. For them, the rhinoplasty surgery may be the answer. Rhinoplasty is one of the most frequent requested types of cosmetic procedures. It is a surgical procedure which reshapes and realigns the nose, either to repair injury or to correct a deformity which may be hereditary. This is the main anatomical objective, but the benefits may extend way beyond this in terms of enhancement of self-image, greater pose and confidence, and improve performance. Through rhinoplasty, many problems can be reduced or corrected. Long noses can be shortened, crooked noses can be straightened, bumps and hooked noses can be removed, a wide nose can be made narrowed, bulbous tip can be removed, nostrils can be made smaller, and it goes on. It is important to realize that drastic changes to the nose are not desirable for various reasons. For instance, the underlying bone structure may not permit it, or the potential results may not harmonize with the other facial features, and therefore it would look unnatural. Rhinoplasty is a well-established procedure that has been helping men and women feel more attractive and self-confident for years. For the most popular forms of aesthetic surgery, it may be done in two different ways. 1. Closed rhinoplasty. All the incisions required to shape or reshape the tip and the bridge of the nose are placed inside the nostrils. As a result, there are generally no visible external scars unless the size of the nostrils is also reduced. In this case, there may be small scars in the furrow between the nostrils and the lip. Open rhinoplasty can be preferred by some surgeons. The approach, because it gives them greater control if intricate reshaping is required for the cartilages in the tip of the nose. Today, the use of computer simulation in the preparation for surgery has led greater accuracy of the planning of the process and higher expectation from the patients. During your consultation, your surgeon will ask you about your general medical history, any previous surgeries or injuries to your nose. Most people would like the noses to be smaller. In some cases, though, an increase in size may be appropriate. Only by telling your surgeon exactly what you want can he or she determine whether it is possible or desirable. At the same time, you need to be aware of everyone is different, and what may work well for one person may not work well for another. For example, skin thickness varies enormously, and small delicate noses can rarely be made from a large thickened one. During the consultation, your surgeon may also use computer simulation to help you see what changes are feasible and what they would look like. These simulations can often help patients describe the results they want and the changes they would like to avoid. The operation is usually performed under twilight anesthesia, which ensures that you will be relaxed and peaceful during surgery, or general anesthesia can be used if preferred or if necessary. The procedure itself takes about an hour, depending on the individual case. If local anesthetic is used, a day's stay in hospital will be sufficient, whereas with general anesthesia, one-night stay will be required. Rhinoplasty involves the removal or alteration of nasal bones and cartilage. The skin subsequently adapts to the new bony arrangement of the nose. Surgery is usually performed internally, that is, from inside the nose, thus leaving no visible external scarring, except under special circumstances. For instance, to alter the nostril size, an incision may be required at the side creases of the nose where it meets the face. But these incisions normally heal very quickly and scars become virtually invisible. After the operation, a small splint will be applied to protect the nose and maintain its position during early stages of healing. Following surgery, swelling and tenderness and discoloration about the eyes and nose is normal, but this will subside during the following 7 to 14 days. It's very important, obviously, to avoid injury or distortion to the nose during the healing process and to follow the surgeon's instructions on aftercare very closely. The nose will be presentable after the plaster is removed, usually at 1 week, and makeup is then allowed. One can return to work after 7 to 10 days postoperatively. Full benefits of surgery takes some considerable time to develop. I cannot overemphasize the importance being patient in the postoperative phase. Major changes are apparent immediately, but your nose will continue to change to a certain degree up to 2 or 3 months. It usually takes 6 to 9 months for all the subtle contour changes to take place. This process cannot be hurried, and nature must be allowed to take its course. It is a lengthy process, and patience and understanding are required. The results are often dramatic and in most cases will last for a lifetime. Suitability for this type of treatment, as with any other treatment, will be assessed by the surgeon at consultation, but is based on several factors, including the general condition of the patient, the past medical history. The specifics are best discussed with the surgeon for a complete understanding of the potentials in any individual cases.